For snoring and sleep apnea, we do offer appliance therapy, appliances you can wear in the evening, which basically move the lower jaw forward. By advancing the lower jaw and moving the tongue forward, it opens the airway in the back of the throat. This is something that's not done individually by a dentist, but has to be done in close consultation with the medical team, usually at a sleep center, maybe of a local hospital. Any patient who suspects they may have problems as far as sleep apnea or snoring. Snoring can be an early sign of sleep apnea. Sleep apnea can be life-threatening. Anybody suspects they have a problem like that first needs to have an evaluation by a sleep center, by a medical doctor, in which case when the sleep studies are done, they're pronounced or they're given a diagnosis of sleep apnea. There are some medical type of corrections for that. People have probably heard of CPAP machines, which just push positive pressure air into the airway. You have to wear a mask at night. A lot of people can't tolerate wearing a mask with a CPAP machine, and that's where the oral appliances come in handy. I have a few patients that we've made appliances for that they're traveling on the road, business trips and things like that. They don't want to carry a CPAP machine around, plug it in and wear a mask when they're on a business trip. So they'll have an appliance that they wear, which will do the same thing, open the airway up while they're away. And some people just can't tolerate wearing the CPAP machine, so the appliances are a second phase of treatment if need be.